Hi, everybody. My name is Anastasia, and welcome to my channel. If you've been here before, thank you so much for coming back. If you're new, come on in, make yourself at home. Here, we talk about everything. So, have you ever felt that you are at a doctor's office, you are a doctor's appointment, and you felt you were rushed? There wasn't enough time to ask all your questions, there wasn't enough time for the doctor to explain everything to you? Well, it is happening, but there are some things that you can do to help make time more efficient at your next doctor's appointment. So come on in and let's have a chat. So, typical primary care appointment is between 15 to 20 minutes. And yes, that's not a lot of time because between that 15 to 20-minute time period, the provider has to review your medical records, review your medication list, listen to your concerns that you came in with, put in any referral, any medication needs to be sent out, look at any labs, and make sure documentation is done accurately. All this is happening within a 15-minute time period. So, yes, it's not a lot of time. And also, as a provider, you want to make sure that you don't fall behind because we're typically booked the whole day. Like you're seeing somebody the whole time that you are at work. So if you fall behind, not only do you not, your patients are unhappy because they're sitting in your waiting room 20, 30, 40 minutes waiting for you, and they just feel like why is the doctor taking so long? But also, you as a provider, your day becomes longer because you're going to be staying after hours to do documentations, and nobody wants to do that at the end of the day. So it's really hard to balance between seeing everybody, pleasing all your patient, and also making sure that you are managing your time effectively. Another reason why your appointment might feel like it was rushed is because you're coming in with like five, six, seven different complaints. It's better to come in with one or two top priority complaints to address in one particular visit, and then you can reschedule for another day and come back for, your next priority, whatever else is worrying you. Because if you have 15 minutes and we have to address five, six different things, we have to ration the time. So we're probably going to give you maybe 2 to 3 minutes per, concern. Whereas if you come in with just one or two concerns, we can devote more time to address each one of them. Another thing you can do on top of prioritizing what concerns you want to be addressed, writing it down also helps. So if you remember, okay, I'm going in with like I have a headache, number one, my nose hurt, number two. So I go in, I write it down. I know I'm going to tell the doctor I have a headache all the time. Number two, my nose is bleeding. That's it. That way it just flows. You remember exactly why you're there, and it just makes the visit more efficient. Also, bring all your medications or write all your medication. And a lot of patients that I appreciate this so much is that they have a medication list that they keep track of. So they will have a printout of all their medications. They bring it in, and it just makes time more efficient versus what medications do you take? I take a blue pill. That doesn't help because there's so many blue pills. I take a white pill. I don't know which white pill. So if you have a list, it just makes it easier for us to run through it and make time more efficient. Next is be more specific. So if you have pain, come in, okay, I have a knee pain. It comes in maybe every night after work. I get the pain. I've been having the pain for the past 2 weeks. It's achy or it's throbbing or it's numbness. Be more specific about your complaint or your concern. That way, the follow up questions are not so much, which also eats into the time. So if you come in and you're like, this is the problem, boom, 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 boom. Oh, okay. Then we can easily come up with a plan and move on to the next concern. I hope what I'm saying makes sense. Versus if we're trying to figure out So you have pain. How long have the pain been going up? I don't know. I'm not sure. Then we have to kind of like retrace your step. When was the first time you felt the pain? What were you doing when you felt the pain? On a scale of 1 to 10, where will you put the pain? It just, it's like dragging and dragging. But if you come in prepared, you just give the facts, you give the information to the provider, it just makes time more efficient and everybody is happy because we're like a well-oiled machine. We're just running through and everything is going smoothly. Now, this doesn't mean that every visit has to be like, sometimes things happen, you don't, have all the information, that's fine. But for the most part, if you're going in prepared, it just makes time more efficient and better run for both the provider and the patient. So, in conclusion, all providers want to help. That's why we do the job that we do. We want to help. We want to make people feel, we want to make people feel better. But unfortunately, because of the medical system that we're in, there are some limitations to time management and also even regarding, what kind of tests and what kind of medications that insurance will cover and all those things. So if a patient comes in prepared, it just helps make time more efficient, more useful for both the provider and the patient. You can always schedule a follow-up visit. If you let's say you have a headache, you have a knee pain, you have a waist pain, you're coughing, which one is more troublesome for you? Maybe the headache and the cough. Okay, so this visit, we're going to talk about the headache and the cough. And then you follow up, you make another appointment, maybe next week, and then we're going to talk about the knee pain and the hip pain. So that way, we are addressing each thing with more time, with more precision, and with more information. I hope you found this video helpful. Please share. Please leave any comments, any tips, anything that you have done in the past that has proven more efficient and more use of your time at your doctor's appointment. Put it down in the comments so we can all learn and share with each other. Thank you so much for your support. Thank you for watching, and I'll talk to you soon. Bye.